Good morning, everyone. This is Afnan. I'm from Team Oziva, welcoming our experts on board today to discuss all things about PCOS. We have Dr. Yuvraj Jadeja, Dr. Aditi Tandon, and our in house nutritionist, Shikha.
Hey guys, good morning. So this is Dr. Yuvraj, well known as Dr. UV on social media. First of all, I'd like to thank Uziva and its team for inviting me for this panel. I am a fertility expert, an obstetrician and gynecologist, of course. I practice in Vadodara, Gujarat, and thank you for having me.
Dr. Aditi, we would love for you to introduce yourself.
Thank you, Team Oziva, for having me. I am a gynecologist, a fertility consultant practicing in Mumbai and Navi Mumbai, and I'm looking forward to the discussion we're planning to have today on PCOS.
Thank you. Shikha, please.
Thank you for having me, guys. This is Shikha Divedi. I am a clinical nutritionist and a dietitian and a certified diabetes educator as well. Thank you for having me.
Thank you for coming on board, all of you. We recently asked our audience a few questions about PCOS, a few concerns that they may have, and we are here to answer all of them today. So we have a list of few frequently asked questions, and the first and the most basic one is what exactly is PCOS and what is the difference between PCOS and PCOD?
PCOS is basically polycystic ovarian syndrome. It is a metabolic and an endocrinological condition which affects women of childbearing age, which is 15 to 45 years of age. PCOD and PCOS is essentially the same. PCOD was a term which was used to denote this condition earlier. So it's no longer called PCOD. We prefer calling it a syndrome because it is multifactorial. As I already mentioned, it is a metabolic and an endocrinological condition that affects women of childbearing age. So PCOS is a more suitable term to call it, as it's not just about the ovaries, it's much more than that.
Thank you so much for that, and this was actually very informative for me as well. Dr. Yuvraj, why do you think there is lack of awareness about this topic, PCOS?
Honestly, I believe there's a spectrum. There's a group that actually do not really know what we are talking about, what PCOS is, and how it takes care, how it kind of gets into your body and what it does. And then there is another group which is so overly educated that they overdiagnose themselves, right? So it's both the spectrums. Where you're considering the masses, yes, people are not aware because as anything in female health, it's less talked about. It's only with the onset and the popularity of social media that all of us are now talking, everyone is talking about PCOS, but the actual education around it at the grassroots level is definitely less. The awareness is less because one, it's not a life-threatening disease, so to speak, if you put it under a quotation. It's not a life-threatening disease, so it was not given that importance. But now, due to its widespread effects from, as Dr. Aditi mentioned, from metabolic, that means now we know it can cause diabetes, hypertension, cancers in future, to infertility in reproductive age, to a lot of other mental disorders such as body dysmorphia, acne, everything. Now the entire conversation has started. And then there is an entire other spectrum which, anything happens to them and they feel that it's PCOS. So, there the diagnosis has to be actually done properly to determine whether it's PCOS or not.
Wow, that was really insightful. And Dr. Aditi, how do you think we should diagnose PCOS? Aditi and Yuvraj, I would love to hear answers from the both of you.
I'm very glad that doctors are coming out and putting information about PCOS, on social media and other platforms. Coming to awareness, yes, it is lacking. And not only that, there's a lot of misinformation about this condition, on the internet. And that's a concern because you don't want these people to, not get the right advice and to not have the right source for information.
Just adding on to that, what is of my experience, I feel there is still lack of acceptance as well in women regarding PCOS, that they will come with different symptoms, like I just have irregular periods, I just have facial hair, and खुद ही diagnose हो गया होता है that yeah it's not PCOS. I don't think it's PCOS. It's just one symptom that I have without getting going through the proper screening test and getting it diagnosed by the doctors as well. So it is very important that to accept the fact to go get yourself checked out there.
That's right. In fact, I know a lot of my friends, you know, who are PCOS warriors, and it took them so much time to actually be aware and reach a point where they finally know what it is and what needs to be done. So, but then, you know, I would love for Aditi and Yuvraj to answer for our audience. How do you diagnose PCOS?
So essentially, there are three things that can happen in PCOS primarily. One is irregular delayed periods. It happens because there is no ovulation that is happening. The second is signs of excess androgens, which could be acne, hirsutism, and male pattern balding. And the third is on a sonography, the ovaries appear polycystic. Essentially, they are larger and they have multiple fluid-filled follicles on the periphery. It is a characteristic polycystic appearance. It does not mean that the ovaries have cysts in them. In fact, it's a misnomer. It is essentially just an appearance of the ovaries which make them larger in size and volume. So to diagnose PCOS, you essentially need 2 out of these 3 things that I mentioned, and the most important being the androgen X. So I always like to say that testosterone is the culprit, and it is that naughty hormone which is there where it is not supposed to be, and it is creating havoc.
I would love to hear your thoughts, Dr. Yuvraj.
Yeah, I think Aditi has very primarily what is needed, essential points have been pointed out. I just think the diagnosis, anyone who deals with, say for example, a nutritionist, a fitness expert, a gynecologist, a dermatologist, and an endocrinologist. These are the 5 main source of diagnosis. So they always should have their red flags on when someone presents with one half of the symptom or the other half of the symptom. Then of course primarily it falls under the the onus is on the gynecologist to do the scan and to do the blood workup and make the actual diagnosis.
Listening to all this, the thought that comes to my mind is, if I want to diagnose if I have PCOS or not, what are the kind of tests that I should be prepared for?
So as Dr. Aditi said that the first thing is there's a history that is being taken. So your entire history in terms of what you're feeling, what are your symptoms, what is going on with your body and your cycle is evaluated. That gives a pretty fair idea. Then the second thing is an ultrasound, and ideally a transvaginal ultrasound, if not of course a transabdominal. When I say transvaginal, matlab wo per vaginal hota hai, and the transabdominal is the one that is done by putting the probe on your abdomen, the belly. And there you'll see characteristic features. And then the third is a series or panel of blood tests. Now you see a lot of these labs giving you like the entire PCO panel, which might cost greatly. It costs around 8,000-10,000 rupees. But remember that let the doctor decide which tests are absolutely necessary.
Apart from what Dr. Yuvraj has already mentioned, also the lipid profile, because a lot of these women are obese, and you want to know if the bad cholesterol is high, or if the LDL is high or the triglycerides are high. So yes, thyroid, prolactin do affect the menstrual regularity, and often they can even coexist with PCOS. So it's important to know if they are deranged and high, because they need a different kind of management.
Right. Thank you, Dr. Aditi and Dr. Yuvraj. I think diagnosis is the level 1 of fighting PCOS. But Shikha, do you think diet and lifestyle plays a major role in managing PCOS?
Yes, it definitely does play a major role. So the first step towards PCOS management is to adopt a healthy and a holistic lifestyle. So the lifestyle changes that one must be focusing on is to follow a clean plant-based diet. Along with that, one should ensure to include some kind of physical activity, maybe home-based workouts, yoga or gym workouts for around 30 to 45 minutes a day. Third thing is to maintain a proper sleep pattern and to have a stress-free lifestyle. For that, what you can do is you can set aside at least 10 minutes before bedtime for meditation. For a woman with PCOS, the dietary modification should be designed to enhance the insulin sensitivity and healthy weight management, which should include following a high fiber rich diet, protein rich diet, restricting the refined carbs in your diet, and eating small but meals at regular intervals. In addition to these, there are few supplements that you can add in your diet like vitamin D3, chromium and omega 3, which has been reported to improve the glucose tolerance, insulin sensitivity as well as insulin secretion. Along with that, as N-acetylcysteine, which is a potent antioxidant, it improves the fertility as well as the insulin sensitive resistance, it reduces the insulin resistance in the body. Having said that, there is no particular diet or treatment which will suit each and every woman. It has to be a customizable approach depending on the severity and the type of PCOS.
I completely agree. Every PCOS warrior has their own journey. They have their own symptoms, and which is why I think it's best that they all take the approach of holistic treatment plan, which suits the best for them. Which brings me to the next frequently asked question by our audience. Yuvraj and Aditi, how do you think PCOS affects fertility?
There is no ovulation happening in PCOS most often, right? Which is the reason for delayed cycles. So, if there's no ovulation happening, if there's no egg that is being released, how is fertilization going to be possible? How is the egg going to meet the sperm? And how is pregnancy going to be possible? Women with PCOS, menstruators with PCOS, have difficulty in conceiving. And I think, it's very simple to sort of address, because all they need is ovulation induction. We have medications which can actually help to form this one dominant follicle and help induce ovulation, and then we just ask these couples to have timed intercourse. So you will be surprised to know how many women actually conceive with just this simple treatment.
Could you share a few special cases or experiences that you've had with PCOS patients whom you helped to conceive?
Of course, ovulation induction is the first line of management, but sometimes the ovaries are just resistant and they will not respond at all to these medications that you give, So you often have to do a procedure called as laparoscopic ovarian drilling, where through laparoscopy, we make holes in the ovary and we try to reduce the size of the ovary to enable it for ovulation and to make it amenable to forming that dominant follicle. So one of our patients, we had done that and she conceived the first time. Okay, after doing that, she for a second baby, she was again, like PCOS is something which does not get cured as per se, so it's going to still be there even after you conceive. So it's going to be a problem to conceive even for the second child. So she came back to us saying that doctor, वो आपने procedure जो किया था please वापस करो ना, मेरे को pregnant होना है. So but of course this is something that we do only and only if those medications don't help in inducing ovulation.
So, coming to your question of fertility and PCOS, I think Aditi said it. It's the answer is just one word, which he said. The absence of ovulation or the problem in ovulation. Also with PCOS, one thing everyone needs to understand, that there is a reason it's called a menstrual cycle. It's not called a menstrual phase, or it's not called anything else. It's called a cycle because it has to run in a cycle, right? Something comes up and something comes down. That's how it happens, and that's what we are talking about, a hormone. And that's what is kind of disorganized in your body, and which is why ovulation doesn't occur. That's what she pointed out. At the same time, PCOS also, as we've already discussed, has a lot of metabolic problems in your body. It leads to a lot of other endocrinological, or supports or coexists with other endocrinological problems. So, apart from not able to conceive, sometimes a lot of PCO patients are very obese, also have problems with recurrent miscarriages, have problems with, having diabetes in pregnancy and all that. So, basically PCOS also, apart from hormonal imbalances, has an entire inflammatory response in your body, and that inflammatory response in your body affects your fertility level also at some kind of a subdued level. But yes, the main cause of course is the problem in your cycle and ovulation.
And what about PCOS affecting skin? Like, acne, excess body hair, or hair fall. Could you, explain us about that?
Yes, so essentially, what testosterone does is the high testosterone, like even Dr. Yuvraj mentioned, the excess testosterone will be converted into a hormone called dihydrotestosterone, DHT, which is more potent than testosterone. So, both of these hormones basically make the skin very oily. They increase the oil production of the skin. They act on the receptors on the skin, and they cause seborrhea, which is oily skin, which makes it prone to developing acne. So acne could be on the face, on the jawline, it could be on the back, on the chest. Other effects of the high androgens is hirsutism, where there is excessive hair growth on parts where you don't want to have hair, right? So on the face, it can be on the upper lips, the lower lips, the chin, the side logs, the chest, back, even the lower abdomen. Another thing we see in PCOS, especially in women with who have insulin resistance, is acanthosis nigricans, which is this moist, velvety, dark skin. In areas like the back of the neck, on in the armpits, on the inner thighs. So this especially is seen when there is insulin resistance. So that necessitates checking for insulin resistance and also addressing the insulin resistance. And of course, it also causes androgenic alopecia, which is male pattern balding. So the kind of balding that one may see is, thinning of density of hair in the center of the scalp, or widening of the hair partition, or in general the thickness of the hair will become lesser, like you'll see a thinning of your ponytail. And unfortunately, this is something which, if in the advanced stages, is irreversible. So it needs to be addressed at the right time before those irreversible changes have happened. And this is when, of course, a dermatologist definitely comes into the picture.
Can you tell us how these symptoms can be resolved?
I already said that it's a multifactorial sort of endocrinological metabolic syndrome. Even the management is multi-pronged. So it will be a multidisciplinary team of doctors. Shikha has already mentioned, diet, lifestyle, exercise is of prime importance. So that is something that we always will advise to the patient. Of course, see, weight is a sensitive issue, and bringing it up may sometimes offend a patient, but who else other than your doctor is going to tell you to lose weight and to be the most healthiest version of yourself, right? So I think everyone must take it in a very positive sort of influence, and help make that sort of motivate themselves to be on their fitter journey. Maybe some relaxation techniques, meditation, yoga, find a hobby that would de-stress you. All of this will help. Sleep on time, sleep adequately, hydrate well, exercise is very important. And of course, visiting the doctor. Don't hesitate to visit a doctor. Trust your doctor, and they are not going to start you on the oral contraceptive or other medications immediately. It's very individualized, and we look into various aspects before we start that. But yes, oral contraceptives is one of the mainstays of management of PCOS. It helps in regularizing the periods. It will help in reducing the androgens most effectively. Also, additional medications like metformin also helps in reducing insulin sensitivity, and this can be used in combination with inositols, which also are very effective.
So, all three of you mentioned about lifestyle modification. Dr. Aditi also mentioned about weight gain and weight loss, and a lot of doctors advise PCOS warriors to lose weight. Is weight gain one of the causes of PCOS, and how do we manage that?
Obesity and PCOS is like anda pehle aaya hai murgi, right? So, but saying that, as Aditi pointed out, it's very correct. People get very touchy and sensitive, which I understand. Losing weight has multifold advantages on PCOS, right? So I'm not of the belief that obesity is what causes PCOS. It's probably just an unknown form of PCOS which was already existent, and then you suddenly started manifesting as obesity. And very importantly, what I want to point here out is we all have seen what weight loss can do, right? In terms of fertility, in terms of cycle regulation, in terms of cosmetological, dermatological issues that you have had. Why would otherwise a dermat advise you a weight loss? So I understand the concept of talking the way you talk about weight loss, the amount of weight loss that you're suggesting. Sometimes you just say that acha chalo 10 kilo weight you lose karke aana next time. Well, that's not correct. I agree. So as far as your question is concerned, I think obesity, some form or the other, is because of PCOS, not the other way around. Also because what happens in PCOS is you have insulin resistance. Now let's talk science, right? There's insulin resistance because of which you keep on getting these cravings to eat, which is because of the insulin resistance. Now, because of that, you tend to add on your fat and your sugars in your body, your cravings. If you don't give in to those cravings, that means your body is going to work properly. You're not going to store that extra calories and extra fat that is going to happen. Secondly, decreasing sugars, decreasing the amount of going on a calorie deficit diet, and increasing your protein levels. Your protein levels will reduce your sugar consumption and the needs for sugar. Secondly, your insulin resistance will not cause all those effects that your unmonitored food and cravings was causing. Losing weight will also help you with insulin resistance. So the less your insulin resistance starts decreasing, your cravings will start decreasing. And ये एक rule है. You see, once you start working out, you start taking care of your diet. If you start taking care of your diet at the same time, you start working out, because you know what is working, then you start feeling good. So yes, obesity is definitely associated with PCOS. It needs to be addressed and it needs to be treated, because it is one of the simplest forms of treating PCOS actually.
Right. And Dr. Yuvraj, since you mentioned about diet and nutrition, Shikha, since you're a nutritionist and having a nutritious meal helps in weight management. So what are your thoughts about this?
He correctly mentioned that actually the fact is PCOS and obesity have a very complex relationship, and there are many genetic as well as environmental factors involved here. So what I believe is that hypoandrogenemia that is seen in PCOS, as he said, it leads to the development of visceral adiposity. So correctly mentioned, what we require is proper management through diet, through lifestyle modification, proper treatment through supplementations, as we all three of us mentioned.
Yeah, I just want to add to that. Even 5% of weight loss will make a difference in PCOS symptoms. Your cycles may start getting ovulatory. You may get pregnant with just a 5% of weight loss. So that's how important weight loss in PCOS is. It's not for no reason why doctors keep saying that you should lose weight in PCOS. Of course, you cannot advise that to somebody who is lean and having PCOS, because there is also an entity where lean women can also have PCOS, but it definitely plays a role in women who are obese and who have PCOS.
Yeah, as she correctly mentioned that not all obese women will have PCOS, and not all PCOS women are obese. So it is very, very customized here.
Okay, thank you. And that brings me to a very important question, and I'm sure all of y'all here must have come across this from some PCOS warrior or the other. Is there a cure for PCOS?
No, there is no as such cure for PCOS, but yes, as we said, that through dietary modification, lifestyle modification, and treatment, the symptoms that these women have can be managed and suppressed.
Yes, there's no cure, but it's not a lifetime sentence. You can absolutely manage your PCOS symptoms, and like Shikha mentioned, lifestyle changes will have a beneficial role in keeping those symptoms in check. You don't even have to think of curing PCOS. If your symptoms are in check, you are achieving the goal.
Okay, Dr. Yuvraj, let's consider that someone was able to manage PCOS really well and followed a holistic approach towards managing PCOS. Are there chances of a relapse of PCOS symptoms?
Of course. See, as I said, PCOS is a cycle. You're living that cycle, and sometimes after a point, things that you're already, it's like, again, it's I would draw a parallel to a weight loss journey or a nutrition journey. Sometimes after a standard treatment that has worked for you for some time, it might stop working for some other time, but then you have to tweak it. That is where your doctors, your nutritionists, your fitness experts are there. For example, if you were just concentrating and doing great on your lifestyle, doing great on your diet and exercise, and then probably you're again showing some symptoms or some so-called spikes in your symptoms, your doctor might add you on certain supplements. They might add you myoinositols, they might add metformin into the picture, and you might do well. Then again, this whole concept of doing so lifestyle modification is great. That's the first thing you have to do, but at the same time, I'd request, don't be too resistant to treatments, because they are just going to help you, be it supplementations, again, be it Ocipil. This entire conversation around treating PCOS with hormones, well, it's a hormonal imbalance. What do you expect me to treat with? Sugar pills? You have to give sometimes hormones, right? So this is a very important question. So sometimes when your modifications, your simple management stop working, you have to go a step higher. The step higher could be adding supplements, adding inositols, maybe giving an Ocipil once in a while, maybe a course of it for your cosmetological symptoms, for your metabolic symptoms, or even for your menstrual irregularities. So yes, it does happen, and then the doctor and your team probably tweaks your treatment around and then gets back you on track. That's it.
Since y'all are the experts here, could you all share one line for our PCOS warriors? Like, if there's one thing that you would like to convey to anyone who is fighting with PCOS.
Just in one line, I would just like to say to all the women out there with PCOS that do not worry at all. With proper management, dietary, lifestyle, and treatment, you will be able to lead a happier and a healthier life.
Yeah, don't let all the information that's available about PCOS overwhelm you and scare you. It is more commoner than you believe. 1 in 10 women have PCOS, so you're not alone. And with just being mindful of what you eat and your regular habits, you will be able to successfully overcome this.
So I always say that PCOS is a cycle. You're going to have some wins and you're going to have some losses every day. Don't let the losses get to your heart. Every day is going to be different. Get back on track tomorrow. Nothing is lost. And don't let the wins get to your head, because you still need to stay consistent and carry forward. So that's it.
Thank you so much, everyone, for being a part of this panel discussion and taking your time out to come here and address the concerns that our audiences have had about PCOS. I'm sure this will be very helpful to them. So once again, thank you for being a part of this.
Thank you for having us.
Thank you for having us.
And to our lovely audience, thank you for watching. I hope this video will help a lot of you out there. So don't forget to share it with someone you know who is going through PCOS. I'm sure it'll be helpful to them as well. And like this video, and if you have any more concerns, please drop an email at community@oziva.in, and we have experts on board who will be answering your queries for you. So thank you for watching and stay tuned. Oh, and don't forget to subscribe to Oziva TV.